Hi, I'm Dr. Strickland, and today I want to talk to you guys about 5 simple exercises that you can do at home to manage your sciatic pain. So sciatic pain usually is felt right in the buttock and hip and travels right down into the back of the leg, sometimes even further. Now, sciatica in and of itself is not a condition, but it's a symptom of a bigger problem. Those problems could be pinched nerves that are coming from the low back, sometimes from something called subluxation, which is a slight misalignment. Sometimes it could be from a disc herniation in the low back, which is the cartilage between the bones that can squeeze out and put pressure on the nerves. And sometimes it might be a degenerative condition where you actually have bone spurs or a thinning of the disc putting pressure on that nerve canal. Nevertheless, there are ways that you can manage sciatica at home on your own. Let's talk about it. The first stretch is called the knee to chest stretch. You accomplish this by laying on your back with your feet flat on the ground, knees bent, then gradually grab both knees and hug them up to your chest. Perfect. And then hold for about 30 seconds and repeat 3 times for best results. Next is the Cobra stretch. Now to do the Cobra stretch, you're going to lie face down with your palms next to your chest, legs extended and together. Then you're going to push yourself up, extending your back, getting your torso right about 45-50 degrees. You're going to hold that for 5 seconds, and then you're going to repeat that 10 times. If you have a hard time getting this far back, you could also do a modified Cobra, which is when you go down, partial way up, same thing, holding that for 5 seconds, repeating 10 times. Next is the seated hip stretch. To accomplish the seated hip stretch, we're going to start by sitting in a chair. You're going to bend your knees at 90 degrees. Then you're going to take the affected leg and bring that ankle over to the opposite knee. And then you're going to gently lean forward, creating a nice stretch at those hip rotators, which are the muscles that surround that sciatic nerve, creating a nice stretch and increasing the motion. You gently want to hold the seated hip stretch for about 15 to 30 seconds, repeating 3 times. Next is the standing hamstring stretch. Now to accomplish this, we're going to start by standing tall, facing a structure like a table or a chair, and you're going to raise the affected leg and put it on the edge of the structure, and you're going to keep your spine straight while hinging at the hips, bending forward, creating a nice stretch in the hamstring. It's important to understand that you don't need to reach and try to grab your toes. That just creates unnecessary stress on your spine. Once you've done this for 15 to 30 seconds, you can go back to neutral and then repeat that 3 times. Finally, there's the seated spinal twist. To do the seated spinal twist, you're going to sit on the floor or an exercise mat, have your legs straight out in front of you. You're going to bend one leg and put it over the opposite knee, and then you're going to take the opposite elbow across that knee, and you're going to have a gentle twist on your spine, creating a nice stretch in your low back and hip. You're going to gently hold this for 15 to 30 seconds, go back to neutral, and then repeat the same thing on the opposite side. With the spinal twist, you also want to repeat 3 times. So these are great strategies to manage your sciatic symptoms at home, but if you're struggling to overcome it, please seek a professional opinion. And if you'd like to contact us, you can do so at betterlifechiro.net. And if you like this video, be sure and like and share.